In this video, I will be showing you how to create notifications for when blood pressure screening is due. So we will go to Setup, Charting Setup, and CDS Query Setup. So we'll create a new query, and we're going to call it BP Due. And we're going to want to make sure the Notify on Chart is checked, and that's what will make the notification appear. And I'll show you what that looks like later. So let's save the name and then start adding the criteria. So first we're going to put the age range. So we'll go to Clients and we will put age 18 and over. And we will also put client type as valid Alberta patient. Now the way that I'm setting up this screening, I'm going to have the notifications showing for all doctors. So I'm going to leave the default doctor blank. If you wanted to have it for one physician specifically, then you could select it from the drop-down and check the default doctor box. But we're going to leave it so that it's open to all physicians, so that it notifies on everyone's charts. So we're done with that line, so we'll hit Save Line. Then we're going to add where you would find the blood pressure recorded. So we're looking under Chart Notes, and usually a clinic has a few different places where they put blood pressure. So for mine, there are going to be 3 spots that I have it. So let's look under Physical Exam Female first. That's one of the places I know has blood pressure. So once you click that, then we click the Chart Fields box. And all of the fields that have blood pressure, or that are in this template, are going to all come up. So I know from experience that we have 2 places that blood pressure is recorded in the physical exams. One is BP supine and the other is BP sitting. So here's BP supine, and we're going to put the operator greater than or equal to 1. So think of this like binary. We want something to be in this field. Then we're going to change this to OR, and then we're also going to add the BP sitting. And we'll put the same greater than or equal to 1, and again make sure that we put OR. Finally, we want to have this looking back under 1 year ago, because that is the criteria that's set out in the maneuvers. So finally, we're going to make sure that we check the Not button, since we are looking for people who do not have a blood pressure here. So we'll save that line, and then we'll add another new line, again Chart Notes, and this will be for the male exam. So we'll select that, and same deal over here. We'll look in the chart fields, and first we'll find the BP supine, and we'll put greater than or equal to 1, and then the BP sitting, also greater than or equal to 1. Again, we'll put the visit date looking back 1 year, and we will make sure that we'll put the OR in between this so that it can be either in the female physical exam or the male physical exam. And we'll bump this level up to 2 so that it indents. And you'll see what I mean there. So finally, we also in my database have blood pressure in the ASAP chart note. So I'm going to add that one as well. So there's the ASAP, and if we look in the chart fields, this one under here, there's just 1 blood pressure. So we'll select that, put the operator greater than or equal to 1 in order to have something in the field. We'll look in the visit dates, and we want to go looking back 1 year ago. And we also want to make sure that this is OR logic, and bump this up to level 2 so that it also indents. So we have patients who are over 18 and who do not have a blood pressure in either of 3 places: physical exam female, physical exam male, or the ASAP chart note. So we'll hit save and then close. So let's see how many people need their blood pressure done. So 190 patients for this practice. And you wouldn't necessarily run the report like this to look at it, but I'm just doing this so that I can look in a patient's chart and see if the notification is showing up. So if I go into their charting module, you can see that this patient has 3 notifications, and I click on the plus to expand it, and there we go, blood pressure due. So that is how you would set up notifications for blood pressure.